Hello everyone, I am Dr. Roji Philip, consultant proctologist and laparoscopic surgeon in Fortis Hospital, Vashi. Today we are going to discuss about some of the most common proctological problems and some of the myths and facts regarding the same. Now, one of the common myths that we encounter is that all bleeding or pain in the anal region is because of piles. But this is not always so. It is very imperative that we distinguish between the common problems we encounter here. The first most common problem that we find is hemorrhoids, or what is commonly known as piles. So what is hemorrhoids? These are dilatation of the anal cushions in the anal canal which contain blood vessels. It happens as a reason of chronic straining and constipation. So the patient has pain in the advanced stages and just painless bleeding in the early stages. In the advanced stages, you may also have a swelling which is visible externally. So after clinical examination and a diagnosis of the grade of hemorrhoids is made, we are able to provide the appropriate treatment for the same. It includes lifestyle modification, high fiber diet, and surgical intervention in the advanced stages. So the surgery involves conventional surgeries like open Milligan hemorrhoidectomy or Ferguson hemorrhoidectomy, or nowadays we are employing either stapler hemorrhoidectomy or even more better is laser hemorrhoidoplasty, which can be done in selected cases. Now the advantages of these newer techniques over the conventional ones are that the cut is very minimal and the pain is less, the recovery is early, and the patient is able to go back to work at an early stage. The second problem that we commonly inquire is what we call as an anal fissure. Now this is nothing but a cut in the mucosa of the anal canal which happens as a result of straining and passage of hard stools. So once this is diagnosed, we put the patient on warm water sitz bath or flavonoids and some other medications, and most patients recover with that. But those patients who have a chronic problem may need surgical intervention. And nowadays with laser, we do something called as a fissurectomy and a lateral internal sphincterotomy with a very minimal cut. So the patient is able to have a good recovery and get back to work early. The third most common problem that we encounter is anal fistula with or without abscesses. Now these arise because of infection in the anal glands, and the patient usually presents with discharge in the perianal area with passage of either pus or blood. So once we see the external opening, it becomes important for us to do a clinical examination and try to find the internal opening. The fistula usually has a track which connects the internal and the external opening. So sometimes an MRI is required to find out how the tracks are moving through the sphincter muscles, and based on that the treatment is decided. Now we have conventional surgery which involves cutting through the sphincter muscles. So another myth is that most of these surgery cause some kind of incontinence, but with the latest techniques it need not be true always. We use laser nowadays to ablate the entire fistula tract, and the patient is able to get back to work early and the recovery is much faster. I would also like to discuss another problem which usually happens in the sacral or coccygeal area and what is called as a pyronidal sinus. Now this happens because of invagination of hair into the skin which is very thin over the area of the coccyx. It's also called a jeep driver's bottom, wherein people who sit for a prolonged period of time are more prone to get this disease. So in this, there is a sinus tract which forms with a nest of hair just below the skin, and there is discharge of pus or blood from the sinus. So once it is diagnosed, we can do either a conventional surgery wherein the entire tract is excised and we cover that area with a local flap. But nowadays, with the advent of laser, a 1470 nanometer diode laser can be used to ablate these tracts along with mechanical debridement. This helps in complete recovery and the patient is able to get back to work at an early stage. So these four proctological problems are very common that we see in our community, and it becomes imperative to diagnose them at an early stage and intervene nowadays with the help of laser at an early stage so that complications can be avoided. We here at Fortis Vashi are providing the entire gamut of care required for these proctological problems.